Well, good morning, everyone, and welcome to today's webinar, Keeping Older Drivers Safe. We thank you for being here. These complimentary webinars are brought to you through a collaborative partnership with O'Connor Mortuary, Care Choice Hospice and Palliative Services, and Alzheimer's Orange County. And I'm Kim Bailey of Alzheimer's Orange County. And we provide this monthly webinar series to present various topics of interest to professionals working in the aging and Alzheimer's and hospice fields. So we're very happy to have all of you here today, and we're very happy to have an excellent speaker, Debbie Ricker, who is going to talk about keeping older drivers safe. And you're in for a treat. Debbie Ricker graduated from Loma Linda University with a degree in occupational therapy. She is a driving rehabilitation specialist and specializes in working with older adults. So she is also a certified dementia trainer and actually is one of the nation's leading experts on driving and dementia. She's presented on the state and national level, talking about the effects of dementia on driving. She also assesses individuals who have other chronic conditions like Parkinson's, stroke, diabetes, tumors, brain injuries, any medical conditions that could affect an older adult's ability to drive. And so I am going to turn it over to Debbie. And Debbie, again, we're very thankful for you being here and look forward to your presentation.
Thank you. So I'm going to start out with a quiz. You can answer this for yourself. Most older drivers cease or restrict their own driving when they experience changes in their ability to drive. And if you answered true, that's the correct answer. Most older drivers do stop their driving when they're not safe to drive. The problem is the population with dementia, they don't stop driving because they lose their ability to have good judgment with their driving and to realize that they're unsafe to drive. So we have to look at people's belief system. So what is your belief system about driving? You probably view driving as something that's integral to your life because you drive everywhere you go. Here in Southern California, it's nothing for people to drive 45 minutes to go to dinner. And so we view that as freedom, as independence, and it's a symbol of adulthood. You probably remember when you were a teenager and you were so excited to go to the DMV and get your driver's license so that you could drive on your own. And so it's something that's really, really important to people. So the meaning behind the privilege, like I said, we usually get a license as teenagers, but we also have to have the following requirements. We have to maintain good vision. We have to know what the traffic signs mean. We have to know what all the laws of the state are. We have to be medically safe to drive. And sometimes people need retesting on the road if they have a condition that pops up or they have an injury. Sometimes it requires for people to have a driving test to maintain their ability to drive. And so the problem is that some people think that this is a right for them to drive, but driving is actually a privilege. So I want to go over reasons that seniors typically stop driving. And as you'll go along with my presentation, you'll see that I am gearing this towards loved ones. And the reason that I'm giving you this presentation is because I want all of you to be able to be a trainer so that you can go out and share this information with family members and other medical professionals, because it's helpful for people to know when an older adult needs to be tested or when they need to stop driving. So the number one reason typically that seniors stop driving is because of vision impairment. So it's common for our vision to diminish as we age, but there also might be a disease of the eye like macular degeneration or glaucoma or something like that. Also, people tend to get more emotional when they're driving as they age, and so they can become more nervous. Sometimes they get angry and have road rage. I've had a lot of people tell me that they won't drive on the freeways in Southern California anymore because it's just too stressful for them, and so they only take side streets. It's also normal for us to have some diminishing cognitive abilities as we age. So our processing skills are slowed down, our reaction times are slowed down. Those are normal as we age. Sometimes people have medical conditions that make it difficult for them to drive. And sometimes medications will interfere with a person's ability to drive. And it's also very expensive to drive a car. It's expensive to buy one, to maintain it, to pay for gas, all of those things. And so if a person is having financial difficulties, they might give up driving. If a person has a pattern of close calls, so they may not cause an accident, but they're close to it. And like I said, with lacking confidence, I've had a lot of older adults tell me that they just won't drive on freeways anymore. Or I've had people tell me that they only make right turns. They won't make left turns anymore because they're afraid that they can't do it safely. Sometimes people are encouraged by others to stop driving, and loss of license. Although losing a license doesn't always stop a person from driving. I actually tested a gentleman who was 92 years old. He had had his license pulled because of an accident that he caused. He went down to the DMV. He got a California ID, which is not a driver's license. And when I tested him, he showed me his California ID, and I said, "This is not a driver's license." And he said, "Yes, it is." So he was so confused that he didn't even know he had a California ID, yet he went to a Jaguar dealership, paid cash for a new car, and was driving this brand new Jaguar without a license. So what changes with age normally? It's harder for us to focus on close-up objects. So if you see people having difficulty reading their pill bottle, for example, that's a normal change with age. Our ability to switch from near to far. So if you're in the car and you're reading your gauges in your car and then you have to look up to look at the traffic, it's harder for us to switch back and forth. Also, our peripheral vision will diminish normally as we age. And then our pupil reaction time, so going, for example, from a very shady neighborhood to a very sunny area, our pupils don't change as quickly as we age. And then most people have arthritis, and so it can affect steering, it can affect the way that you handle the car, and back and neck pain are very common. Also, people begin to lose their high frequency sounds. I tested a woman who the driving instructor told her make a left turn at the next signal light, and just as he finished saying that, we heard two emergency vehicles. It was a fire truck and an ambulance going in front of us. And this woman tried to pull into the intersection, so she didn't even hear the sirens on the two vehicles, and she didn't see them either. And it just so happened when we were driving the other direction to take her home, she did the same thing. She tried to go into the intersection. The same two vehicles were going the other direction. And again, she did not hear or see them. And so the driving instructor had to stop her from going into the intersection. So she had lost her high frequency sounds. Also, divided attention, that's multitasking. We know now by research that the human brain is not supposed to multitask, but when we drive, it's the ultimate multitasking that we have to do. There's a lot of things that we have to pay attention to, and this changes normally as we age. And then we also have slower processing of signals in the brain. So taking in information through the eyes, processing that information in the brain, and then the body has to respond to it. This slows down normally as we age. And our sensory perceptions can become weaker too. And it makes it even more complicated. For example, with peripheral neuropathy, people can have numbness in their hands and their feet. And if a person has peripheral neuropathy in their feet, they obviously can't feel the pedals well, and it's going to make it more difficult to drive. And then as we age, the brain needs more information to be able to make a decision. So the effects of an aging body, typically the muscles get weaker. Typically we have arthritis, and so it's harder to move around. The joints stiffen up. We have decreased flexibility. All of that can lead to difficulty with driving. One of the most important things that a person needs to do when they're driving is look over the shoulder before making a lane change. And that's something in the California DMV, they require people to do that. And during their driving test, if a person fails to look over their shoulder prior to making a lane change, 2 times during the test, they flunked them on the spot. And so as we age, it could be more difficult to look over the shoulder, but it's an important thing to do when you're driving. So what are the effects of an aging mind? So we're going to have more difficulty with concentrating. The reaction time is, of course, going to be slowed down. And sometimes people will have momentary confusion. We have some new signal lights here in California where it has a green arrow and then it flashes yellow. And so that's a new signal light. It's not in every intersection, but I find that older adults, because they aren't familiar with that signal light, they can actually become confused in the intersection because they don't know what that new signal light means. And it can all lead to faulty decision making when they're driving. So what changes with vision as we age? I'm going to go over the different types of vision that we have. So we need to be able to see moving objects when we drive. We need to be able to see bicycles and motorcycles and cars and trucks and all the other vehicles that are around us. We need to be able to see that they're moving. We also have to have good depth perception. The most common accident that people with dementia make, that they cause, is making a left-hand turn with oncoming traffic. And the reason for that is because a person with dementia has impaired depth perception fairly early in the dementia process. And so they don't know how far away cars are, how fast they're coming. Also, we have a useful field of view. This is an occupational therapy term. It's the area that you can actually see and then process the information and then respond to it. We also have to have good contrast sensitivity. So if there's a green car driving in front of green bushes and trees, we have to see the difference between the car and the bushes. If there's a gray car and it's really foggy day, we need to be able to see the difference between the car and the fog. So we've got to have good contrast sensitivity. And then we also have to have good reaction time. And glare recovery is a big problem, especially with halogen lights at night. I find that a lot of people complain about they get blinded temporarily by these headlights. And so this changes normally as we age. Also, our peripheral vision gets smaller and smaller as we age, and it's very small with dementia. And I'm going to show you an example of that in a few slides. And then our pupil reaction time, being able to enter or leave a tunnel or sunny, shady area, our pupils slow down in our reaction time. So what types of vision impairments are there that are most common? So cataracts causes blurry vision. So if you held a piece of wax paper up in front of your eyes and tried to drive with that, it would obviously be very difficult to do it. And so it's just general blurry vision. So with glaucoma, what I want you to do is I want you to make binoculars with your hands, put it up to your eyes, and imagine trying to drive with binoculars in front of you. And that's what happens with glaucoma. You don't have peripheral vision. All you see is central vision. And so you can imagine even walking would be difficult, and driving is much more difficult with glaucoma. And then with macular degeneration, if you make fists with your hands and hold it up in front of your eyes a few inches away, imagine trying to drive with that blockage in front of your eyes. It's going to be very difficult. So this next slide, what I want you to do is look at the white area, and you can see what we normally see when we're driving. This is what's in the windshield. So you can see the pedestrians, you can see the cars that are parked and that are driving, you can see the cross traffic, you can see the signs, you can see the traffic light. So that's what we normally see in a windshield. So for people who have difficulty processing visual information, they can only see in the white area. And so you can see that there's a lot that the person would miss. They could see the car in front of them and maybe the cross traffic and the signal light, but it's very much diminished. Now, the next slide is what people with dementia see. It's a very tiny area. It's not that they're blind. It's that their visual processing skills don't work. They're impaired. And this happens early on in the dementia process. And so what happens with a person who has dementia is they only see a tiny bit and process that information. They don't plan ahead. They're incapable of doing that. I don't know if you heard about the story in the farmer's market in Santa Monica years ago with George Weller. he drove through the farmer's market. He killed 11 people and injured 63. The problem that he had was he had a cardiac condition, which means his heart was not pumping correctly, and he had dementia. And so instead of stepping on the brake pedal, he stepped on the gas pedal. He got the two pedals mixed up, and that's why he drove so quickly through the farmer's market. And for him, it happened so rapidly. He didn't even know what happened. He didn't know that he hit anyone at all. He was completely confused when he got out of the car. And it's because he wasn't able to multitask. And people with dementia can't multitask. They can't see and process all the information in the windshield. So here's the cognitive and physical abilities that we need for driving. We need to have abstract reasoning. So for example, if you're going to make a right turn and you need to get over and there's a car in that lane, you have to figure out, do I jump in front of the car? Do I slow down and wait for him to pass and then get over? So we have to have good abstract reasoning to figure out what to do. We have to have good multitasking skills because there's so many things that we have to pay attention to with driving. We have to have good memory because we have to know what all the signs mean. We have to know what all the signal lights mean. We have to know what all the laws of our state are. And so there's a lot of things that we have to remember. We have to remember how the car works. We have to be able to concentrate, to be able to know what's going on with us, all the traffic around us and what the gauges say and everything. We have to have good planning. And then we have to have good perceptual skills and visual processing. So that means we have to be able to take in information through our eyes, process that information in the brain, and then we have to respond to it. And we also need good reaction time, except that as we age, the reaction time slows down. And so all of these things are going to be impacted in a normal aging process. So how does dementia affect driving? The first thing that goes typically is the short-term memory. One of the most common questions I hear when the individual gets into the test car is, where is the gas pedal and the brake? And the reason for that is because they don't have abstract reasoning, and so they can't figure out that the gas pedal and the brake are exactly the same as their own car. And in fact, when they tell me they don't know where the pedals are, I always ask them, have you ever flown anywhere? Did you rent a car? How did you figure out how to drive it? And they always say, well, I know how to drive the rental car, but I don't know how to drive the test car. And they don't have abstract reasoning to figure out it's the same skills for both cars. Again, they don't self-regulate. They don't have good judgment. They also have very impaired reaction time, and their executive functions are also impaired. And then, of course, their depth perception, as I already mentioned. Visual processing skills are also slowed down. So we need to also look at their individual belief system. Are they aware that they have changes in their driving? Are they aware that they're risky? Most of the time, people with dementia are not aware of that. Do they have existing driving habits that are adequate for their driving needs, or have they changed? And then, are they able to drive to places that they need to go? Is there any transportation that they may need to use? One of the things that people have asked me about is, can my loved one take the bus? Well, the problem is it's a very complex task. And so if you're introducing someone with dementia to a bus when they already have dementia, it's going to be a very difficult thing for them to learn. And it's a skill that even if they were to learn it, they're not going to retain it. Also, what do the family and friends believe about their abilities? I've had family members argue with me that their loved one was safe to drive. And the reason behind it is because they didn't want to drive mom to the pharmacy and the doctor and the grocery store and all the places that she needed to go. And so they will argue with me that their loved one should be able to continue driving. And they'll ask me, well, can't they just drive locally? Well, the problem is most accidents happen within 5 miles of the home. So if a person with dementia is unsafe to drive, even driving close to home is not going to be safe. And also, what do the medical professionals believe about their abilities? I find that doctors have very limited time when they see their patients, and so they really don't have time to screen for driving. And most doctors don't know how to screen for driving. And so typically with the medical professional, people will have the white coat syndrome where they go in and the doctor asks them simple questions and they're able to answer it. And so it appears as if they're doing well. But if the doctor doesn't ask the underlying questions about how they're really functioning, the doctor would never know that they're having difficulty. So this is something that you can talk to about family members if they're concerned about their loved ones driving, or if you're concerned about their loved ones driving, you can talk to the family. Sometimes, as I said, it's hard to convince the family that there's an issue with their loved one. So you can ask the family member, do you ride with them, or have you followed them in your own car to see how they're driving? If you're concerned about their driving, have you expressed this concern to their doctor? And then have you introduced driving options? It's better, if we can, to introduce driving options to people before they get into middle to late stage dementia. And it's better if we can catch them even before the dementia has been diagnosed so that we can talk about driving options. Because when you try to talk about options to a person with dementia, they get very offended and they really argue the point that they're still safe to drive even though they're not. So it's important to get through that barrier with the loved ones as well. And these are things that you can look out for as a medical professional. They can translate into difficulty with driving. So does the individual have difficulty filling out forms? Are they taking their medications correctly? Do they have any visual deficits? I can't tell you how many people I've tested who had macular degeneration or cataracts, but they told me they could see fine. So it is an issue, and people with dementia don't have good judgment regarding this. If a person is having difficulty with managing their finances, or if they're taking new medications that might affect driving, if they have a compromised physical status, anytime I test a driver who is using a walker to walk, it always makes me concerned immediately, because if they're using a walker to walk, likely they probably don't have good reaction time. And then look for coordination problems. And if a loved one expresses concern to you about their loved one driving. So those are all things that you can look for. So this is the one question that seems to get through to the family members. Would you let your child or grandchild ride with your loved one? Usually that will make people stop and think, well, no, I wouldn't let that happen. And so then the family may be more proactive in doing something about the driving. So what do I do when I do the driving assessment? What does it consist of? So the first hour is written testing. I'm looking at their cognitive functional skills, motor planning, ability to multitask, all of those things. And then I do an hour behind the wheel. And I'm also looking at the clinical information. So I ask them, how much do you drive? Do you have passengers? I talked to one woman a few years ago who told me that she was living in a retirement community and she would ride with this woman. And she said she was terrified to ride with this woman. And I asked her, why do you keep riding with her? And she said, well, she's the only one who has a driver's license. But that's what happens with these retirement communities. And for a person who's not safe to drive and they have dementia, they're going to continue driving most likely. So I asked the person if they're aware of any problems with driving, if they think they're a safe driver. I tested one gentleman who lived in a retirement community, and he told me he hadn't had any tickets or accidents, but the referral source told me that the way that he always got out of the parking lot in the retirement community was to play bumper boats. And so he would back up and hit a car, go forward and hit a car, and he would go back and forth until he was able to finally get out of the parking lot. But he denied that he had any problems. And I looked at his car and it was completely dented and scraped up, but he had no awareness of what he was doing. So I asked them these questions. Are you a safe driver? Do you get lost when you're driving? Getting lost when driving is a huge issue with people who have dementia. I just talked to a gentleman who said that he drove for 9 hours and couldn't find his way home. Finally, he stopped and a police officer came by and helped him out and got him home. The police officer took his license and said, "You cannot drive again." But what happens when they're lost when driving is they get more and more upset and they make more and more mistakes. And sometimes we have tragic consequences with that. I also ask people if they're aware of getting any tickets or accidents in the last 2 years. And most of the time people will say no, even if they have had them. So we're also looking at the other things that I've mentioned. Their memory, can they remember what signs mean, their visual acuity, all of those things I'm looking at as well. And also the medications that they take. Some of these are kind of surprising, like antihistamines. It says that we're not supposed to drive when we take antihistamines. And what's really interesting is most of the Parkinson medications that people take for Parkinson's actually cause difficulty with driving. And it's something that most people with Parkinson's don't know. I've given a lot of talks to Parkinson's groups, support groups, and the people so far have told me they weren't aware that it impaired their driving. So this is something that also needs to be regulated. And there is a list on the American Medical Association that gives all the medications that will interfere with driving. So we're also looking behind the wheel. So for a person who doesn't have dementia, we look to see if they need any kind of adaptive equipment to be able to drive safely. We're looking to see if they follow traffic signs, if they know the laws of the state of California. What typically happens with people with dementia is they'll drive usually 10 to 20 miles under the speed limit. But there are times that people will drive over the speed limit as well. And there's lots of typical things that people with dementia will make mistakes with as they drive. So keeping the car in the correct lane position, following the laws, going the right speed. They have a lot of difficulty with lane position. They tend to drive in and out of the lane. They tend to make wide turns. So there are many mistakes that are common for people with dementia. So is it a problem? Absolutely. There's over 5.3 million Americans living with dementia, and this is just an estimate, but 30 to 40% still drive. And that's a problem. Even in early stage dementia, it can affect their driving significantly. So by mid-disease, so if you take, we'll start with beginning stage dementia. If you make a scuba mask with your hands and put it up to your eyes and imagine yourself driving with a scuba mask, you're not going to have good peripheral vision. So you're only going to see a limited amount of information in the windshield. And then we already did the binocular one. So if you put binoculars with your hands up to your eyes, you can imagine how much less vision you're going to have with binoculars in front of you. And that's what happens with mid-disease. It's like a person is looking through the size of a binocular. They cannot process information on the outer periphery of the windshield. Also, motor vehicle accidents with a person who has dementia, typically the results are much more serious or deadly. I talked to the wife of a gentleman who had caused 3 accidents. In the last accident, the car that hit him, he made a left turn in front of this car, pulled out in front of him. The car hit him and rolled over, and he kept driving. And the only reason he stopped driving was because his tire fell off of his car. Otherwise, he would have kept going. So his wife asked him later, "Did you know that you got in an accident?" And he said, "Well, I felt a little bump, but I looked at my hood and I didn't see anything wrong with it, so I just kept going." And like I said, the other driver in that accident died, and he wasn't even aware that he had caused an accident. So here's things that you can look for if you're working with older adults. Do they get lost in familiar routes? Do they have near misses, slow reaction time? Do they have errors with driving? Do they have more emotional distress maybe than they used to? Look at their cars. Do they have scrapes and dents on the car? And does the speed match the situation that they're in? Do they drive too slow or too fast? Here's a list of all the things to look for, when to give up the keys. So you've got the handout. You'll be able to look through these more. I won't read each one individually. And so if you're talking to a family member, if my loved one is diagnosed with dementia, do they have to stop driving immediately? And my answer to this is the best thing to do is have them tested by an occupational therapist, because we don't know when in the dementia process the driving will be affected. Occasionally, I will test people who are in beginning stage dementia, and they do pass the test. So in that case, when that happens, I always recommend to the doctor that they be sent back to me within 6 months to a year, because I don't know how fast the dementia is going to progress. And so they really need to be monitored by the physician. So how can we get people to stop driving? One of the things we can do is talk to the doctor. Usually the doctors, when they get my report, are helpful, but I've had a few doctors tell me that they feel the patient is still able to drive safely. You can also get the DMV involved. The problem here in California is we have a box on the DMV form if you report someone to the DMV that they're an unsafe driver, and that box says, please keep me anonymous. But the problem with our DMV is that they will actually tell the individual who reported them to the DMV. And so it can cause a lot of problems, for example, if a family member reports them to the DMV. And I've heard cases that police officers will actually take a license on the spot, so they can be helpful. The problem with trying to get police involved is they can only do something about a person's driver's license if the person is driving, which means that we have to let them get in the car and drive and then call the police and report that they're on the road, and the police have to try to catch them. So it makes it a little bit more tricky. And always suggest to the family member, ride with your loved one or follow them in your own car and observe them what they're driving. And try to get somebody who is objective to be able to determine that. So here's a comparison of a normal brain and an Alzheimer's brain. So if you look at the size, you can tell that the Alzheimer's brain has shrunk. And you can see that there are a lot less folds here than the healthy brain on the left side. So you can imagine all the changes that are going to happen when the brain is being changed like this, when it's shrinking and it's losing neurons. Now this is a picture. This area is the occipital lobe. And so the frontal lobe is going to be at the bottom of the screen. The occipital lobe is the back of your head. So if you put your hand on the back of your head, that's where your vision center is. And you can see the significant difference with the Alzheimer's brain as opposed to the healthy brain. And imagine trying to drive with this, knowing that your brain, where you process visual information, has shrunk significantly. You're going to have difficulty with driving. And so that's why people with dementia have such problems with driving, because their brain is shrinking, there's less neurons, their neuron connections are being wiped out, and so they're going to have difficulty in multiple ways with driving. Now the sensory and motor strip, if you put your hand on the top of your head, at the back of your head, that's where your sensory and motor strip is. And if you look at the difference between the healthy brain on top and the Alzheimer's brain on the bottom, you can see significant changes. And so that means the person is going to have a lot more difficulty with being able to drive, putting the foot on the gas pedal and the brake, being able to turn the steering wheel correctly. All of those things are going to be changed significantly as they go through the dementia process. So the next one is transportation options. What options do you have in your area, and what skills are needed? Like I said earlier, if you try to teach someone in middle stage dementia how to use the bus, it's going to be very difficult to do, and they're probably not going to retain the information. I have a list of all the transportation options in my area, and I always give them to older adults. One of the options, well, I'll go over here on the next slide. So oftentimes the person has friends and family around that they can help them get around. Public transportation, you can try taking the bus together, but it's likely that the person is not going to remember how to do that. Also, taxis. Now, here in Orange County, we have senior centers that have taxi vouchers, and so the individual is able to get a taxi voucher for less money and be able to get to the places that they need to go. Uber and Lyft are a good option. However, most older adults don't have a smartphone, and so they're unable to use that. I've met a few who have smartphones and know how to use them. I always tell people cars are really expensive. It's expensive to buy and maintain a car, and you're going to save a lot of money if you use alternate transportation and don't use your own car. The Access bus is a bus here in Orange County that is $3.60, and they'll take you door to door. And some cities in Orange County have transportation, so you can look in your area and see what you have available. GoGo Grandparent is a company that's contracted with Uber, and so you can just call and the driver will be there, just like with Uber. The driver will be there within 10 or 15 minutes, but it's a call-in center that has contracted with Uber so they can provide rides. So what if a high-risk driver won't stop driving? One of the things that you can do is disable the car, but what I found is people with dementia have a moment of clarity, and so they can call the mechanic and ask them to come and fix their car. In that case, what I always tell family members to do is write a sign saying, "Mr. Mechanic, please call me at this number before you fix the car." Removing the keys, and I found problems with that too, because if you don't get every set of keys, I found that multiple times people with dementia have hidden keys away, and the family thought they got all the keys, but they didn't. And so their loved one found this key that they had hidden and were still able to drive. So you have to be one step ahead of the individual with dementia to get them to stop driving. Another thing that you can do or the family member can do is talk to the doctor. Express your concern about what you've observed or what you're concerned about, and then you can request a driving assessment for the individual. People with dementia don't really want to be tested, and sometimes they fight me on getting the test. Sometimes they refuse to be tested. So what I find to get a person in to be tested, typically the family or the doctor has to really urge them to participate in the driving assessment. But I think it's really important for people to be assessed if they want to continue driving, because we want to know that they're safe to drive. So there's a list of the different websites that I told you about. The state of California is the OTAC Online, ADED, and AOTA. Those are both national. And so you can look on those websites to find driving assessment programs. And now I'll open it for questions.
Okay, so we have had a number of questions come in during the lecture, and I do believe some of them you've addressed some of them, Debbie. But
okay.
I'd like, one attendee would like to know, what about driving when it comes to MCI, mild cognitive impairment?
Well, it's interesting you asked that. I actually get a lot of referrals from UC Irvine, and they have a brain assessment program. Every person that I've tested who they've referred to me who had a diagnosis with MCI has flunked the test. So there's no guarantee that even with MCI that a person will be able to drive safely.
We had a question about, reporting anonymously to DMV, and I think you covered that issue. Let me see what else we have.
Yeah, I don't know about the other states. I just know that California has that box that you can check to be anonymous. But I also know that there's a lot of people at the DMV here in California who are sympathetic to older adults, and they will tell them who reported them. So I just don't know how it is with your state. But in California, no. And it's statewide. I've talked to other occupational therapists who are in Northern California, and they have the same problem with the DMV.
Okay. And I'm thinking, too, as you say that, Debbie, that, and you somewhat address this, but, we have the same problem with some physicians because by law they're required to report
Yes.
the diagnosis to the DMV, but many of them are sympathetic to their patients, and so they'll even avoid giving the diagnosis of dementia
Yes.
to sort of get them out of that loop, right?
Very true. And
Okay.
I actually did a study with the master's OT students at Stanbridge College, and we asked a group of doctors, do you know that you're a mandated reporter in the state of California? And most of them said yes. And then we asked them, do you report people who have cognitive issues? And most of them said, no, I don't.
Oh, boy. Okay. So I have another question for you. Thank you, Debbie. And just a reminder to everybody on the line, you must be on the line for 60 minutes in order to receive your CEUs. So you should speak and continuing at this time to participate in this question and answer phase of things. The question is, do you believe in mandatory testing of older adults? And I know this is controversial. It's a civil rights issue. It's very controversial, right? So I think we just want to know what you think about that.
You know, I'm really torn about it. We had a law passed in California in 2009 that everybody 70 and older would be tested behind the wheel annually. And then we had a budget crisis and it never got rolled out. I'm not sure that that kind of mandatory rule would be helpful. But what would be helpful is if medical professionals and doctors would keep a closer eye on people. I think that that would prevent us from having to have a law like that. But there needs to be some sort of safety net, because I can't tell you how many people I test that I'm terrified to be in the car with them, and they've been driving. And I see it every day on the road. The other day I was driving to work and I saw a gentleman who looked like he was in his 80s driving in the middle of the freeway, and he had a cell phone glued to his ear. It's illegal to be on the cell phone when you're driving, and it's particularly not advisable for an older adult who has slower reaction time, slower multitasking skills. And so we need to have some way of being able to test people who are not safe to drive or who perhaps are showing some issues. So I don't know, I'm torn on the mandatory age, but we need to have some way of testing people and getting unsafe drivers off the road.
Okay. Yeah, and sort of in that same vein, you know, one of our attendees is asking, you know, in that scenario, what do you do when you're out driving and you see someone and they're, you know, making unsafe lane changes or driving erratically? You know, how should you report that?
Actually, what I do, I have a button on my car radio that I can call 911, and I call them in. I get the license plate number and memorize it, and I call it in right away. That's what I do.
Okay, and Debbie Ricker has a hotline to the DMV on her phone. I want to take just a second to add an additional resource. You know, I'm going to circle back. You're talking about some resources. Debbie, the National Alzheimer's Association has a dementia and driving resource center online that you can tap into. And that if people are interested in going online and checking that out, the web address for that, if you want to write it down, and I can also put it in the chat box, is alz.org/care/Alzheimer's. You know what? This is a long address. I'm going to put it in the chat box for everyone. Okay. I'll do that in just a minute. And then any other questions from our audience? Let's see if we've addressed everything so far. Okay. I think we're okay.
I put my contact information on this slide, so if anyone wants to get a hold of me, you can call me or email me.
And do you want to just go over those resources briefly, Debbie?
So the AARP 55 Alive Driver Safety Program is a good program in that it trains people, older adults, how to keep up with the new laws. And it's actually geared towards every state. And so every time the state changes laws, they put it onto this class. And people should be taking this class annually who are over 55. You can get a discount on your insurance if you take this, and you can take it online in the privacy of your own home. So I've taken it myself. It's easy to take, and it's good information, and I recommend it. The problem with this test is that, or class, it's not going to help people with dementia because they're not going to remember it and use that information on the road. AAA has safe driving for mature operators, so they give classes as well. They also do testing, but what I want to warn all of you is people who work for AAA and do the on-road testing know nothing about dementia, and they're not qualified to do driving assessments with a person who has dementia. But they do that. They have a program for older adults. And then there's the National Safety Council Defensive Driving Course, so you can call them and get information. The Alzheimer's Association also has information about driving.
Okay, thank you, Debbie.
Any other questions?
I'm going to take a look here. I want to mention also that you can call Alzheimer's Orange County and talk to someone on our helpline if you have questions about driving and dementia. And I sent the link out to everyone in the chat box for National Alzheimer's Association. And I wanted to add that when you go there, you can also see some good videos of some of these issues around dementia and driving.
Hi, Kim.
Okay, so, yeah.
We have a question there, a couple of questions I see on how much does it cost to do an assessment. I thought that was a good question.
Okay, yeah, that's a great question.
So it varies. Just to let you know up front, Medicare does not pay for it. The only insurance that pays for it is the Hartford, which is a car insurance company. And the Hartford has worked with the Alzheimer's Association and with the National Occupational Therapy Association. They have some great information that you can get for free. You can contact them and get these booklets. And it talks about how to get someone with dementia off the road. There's multiple booklets that they've made. So the Hartford is a great company as far as doing research about driving and dementia and getting the word out on how to talk to people about it. They have a program called We Need to Talk, and it's a specific guideline on how to talk to people, older adults, about their driving. So they do cover it. I charge $500 for the test. I'm the only OT who goes to the home. What I found was I was testing all these people with dementia, and I'd have to say, well, you can drive home, but you can never drive again after that. And it just wasn't working out. So that's why I go to the home to test people, because almost every person I test has dementia, and most of them do not pass the test. There are two other companies in Orange County who provide driving assessments, and they charge $575. But they're at the hospital, and people have to go to the hospital. So typically the cost of the driving assessment runs $400 to $1,000 is what I've heard from other occupational therapists. But in Orange County here in California, we all charge between $500 and $600.
Thank you, Debbie. I want to circle back to the Hartford Insurance Company and the booklets that you talked about. We have some of those booklets available here at Alzheimer's Orange County. So if anyone would like to take a look at those, you can contact us and we'll be happy to send them out. They are free and they're available through their website, but we have them here as well. Okay, so I don't see any other questions. So I just want to thank everyone for attending today, and I particularly want to thank our speaker, Debbie Ricker, for a very eye-opening presentation. So we're thankful for your expertise, Debbie, and to all the attendees, we're thankful for your time. spent with us. So again, please watch for the evaluation. It's going to be emailed to you in just a few minutes. And you need to complete that eval and return it within actually 5 days if you want to have CE credit for today's class. So before we end, I want to remind everyone of our next webinar, which is about medications. And this is a topic that you've requested in your feedback. So the name of the webinar is Why Aren't We Taking Medications as Prescribed? And we have Dr. Bill Liu as our speaker, and he is a board-certified geriatric pharmacist and a consultant pharmacist with the County of Orange Healthcare Agency, adult and older adult behavioral health unit. So he is an expert in this area and will talk about all of the medication non-adherence behaviors, etc., and what we can do about that. And so, again, we thank you, and I hope everybody has a great day, and we'll see you for the next webinar. Thank you so much for joining, and goodbye.
Thank you.